USA Today is celebrating its 2024 Women of the Year, naming one inspirational woman from each state. Indiana's honoree is a mom who turned her grief into action. Justin Phillips has helped move mountains in Indiana's opioid epidemic, but the progress came at a devastating price. Her son, Aaron, died 11 years ago when he overdosed on heroin. Her response is why USA Today just named her one of the most inspiring women across America. Only a sophomore and the starting quarterback for the Lawrence North football team, Erin's story is an example of how fast addiction can change a life.
Big-hearted and talented, extremely talented as an athlete, just all around charming.
His life cut short by an overdose, Erin's mom started searching for what she could have done differently. At an Indianapolis police roundtable about heroin, she heard for the first time about the overdose reversal drug naloxone.
And I learned about naloxone. And I learned that something could have saved Erin's life.
She was stunned she'd never heard of it, even though Aaron was in treatment.
When Aaron left treatment, they didn't talk to us about the likelihood of his potentially using again, which is very real. It takes 7 times often for people to go to treatment before it actually works. They didn't talk to us about that. They didn't talk to us about naloxone being something that we should consider having on hand. So when I went to that meeting and learned about naloxone, I was like, really, are you kidding? We need to do something.
The first roadblock, naloxone, required a prescription.
Which means I would have had to go to my doctor and say, can I have a prescription for naloxone because someone I love and care about is using opioids? Not something anyone's going to do. Too much stigma and judgment and misunderstanding.
Justin became a champion in Indiana for passing Erin's Law in 2015, which allows any person to get naloxone. 24,000 doses per month are prepped by her team, Overdose Lifeline, the nonprofit she created to help people with substance use disorder and their families.
Anyone can come 24/7, just open the box and take what they need.
The naloxone is sent all over the state, stocking boxes like this one and vending machines, making it as easy to get as possible. Because she lost Aaron so young and knows 90% of addictions start during the teen years, a second mission of Overdose Lifeline is connecting with youth.
I come to Camp Mariposa because my mom, she has a problem.
Her nonprofit created Camp Mariposa, a year-round camp experience for kids and teens who have a family member with substance use disorder.
Camp Mariposa has helped me a lot. You're basically spending time with the people who understand what you're going through.
Overdose Lifeline has created several other prevention programs. The latest is for babies. The nonprofit recently opened Heart Rock, a recovery house in Indianapolis for pregnant women and moms with substance use disorder.
We have like 8 babies over there that are all going to crawl at the same time, and these kids are having a different chance. And I think between Heart Rock and Camp Mariposa, that I believe we're going to potentially really be able to change the trajectory for substance use disorder for kids, and that would be where my heart lies the most.
Being named among USA Today's Women of the Year honors a decade's worth of turning tragedy into change.
It's very bittersweet because I'd trade it all for Aaron. Were it not for Aaron, there's a lot of things that I wouldn't have in my life today that I feel grateful for. So it's just an honor and a privilege, and I do it for all the kids and all the moms and dads.
Great example of a mom working for change here in Indiana. We've got a few other business stories here making headlines in Indiana. The University of Chicago just weeks away from opening its first freestanding facility in Indiana. The health system planning to open an $86 million multi-specialty care center and micro-hospital in Crown Point at the end of April. This is a big deal for Northwest Indiana. The facility will employ 200 workers and is expected to treat 110,000 patients a year. And a new healthcare option for people living in Northwest Indiana. Valparaiso-based community healthcare center Lifeline opening its new facility in Michigan City this past week. The $15 million campus is 3 times bigger than Lifelin's previous clinic and is located near Ivy Tech's Michigan City campus.